back. November is Diabetes Awareness Month. Ann Krudimski, a certified diabetes educator from UnityPoint Health Meritor, is here with, help us because there's so much, I think, misconception and even misinformation out there. First of all, could you explain the difference between type 1 and type 2?
Type 1 diabetes is where your body mistakenly kills off the beta cells through your immune system, and the pancreas no longer produces insulin.
Okay.
So
I'm going to just do this and turn your microphone so we can hear you a little bit better. There we go.
All right.
All right. Now, and let's talk about what's type 1 then.
Well, type 1 is the one where the insulin no longer produces, or the pancreas no longer produces insulin.
Sorry about that. Type 2.
Yep. Type 2 is where we have insulin resistance in our body. And to begin with, our pancreas may produce more insulin, and then over a period of time, it doesn't produce quite enough. So then we need to supplement our bodies with insulin. Or there are oral medications out there that will help our body use that insulin better so our blood sugars don't go so high.
What are some, I guess, because we're talking about both and there's so little time here to get to it, what are the symptoms of both? Are they similar?
Similar. Excessive thirst, having to go to the bathroom a lot. In type 1, there is a lot of weight loss because the sugar that comes from glucose, from things we eat, we need for energy, and your body is just burning through that. There's no energy there, and so you lose a lot of weight. Type 2 diabetes, blurry vision, sometimes headaches, those types of things.
Extreme fatigue as well?
Yep, can be very fatigued because that sugar is not being used for energy, so you have a low energy level.
Which one are you seeing more of these days, type 1 or type 2?
Type 2 is much more prevalent than type 1. Type 1 is usually before age 30, and then type 2 occurs after age 30. And as you age, that insulin resistance becomes more prevalent, and also our lifestyle can play a big factor in that.
So let's talk about who's most at risk, and can we change this by what we eat, for example?
Yep, there are several things that we can do. We are at risk if we're actually over the age of 40, if we are overweight, if we have a family history of diabetes, and then some ethnicities also fall into that category. So we can't do anything about that age thing. That number keeps going up and never comes down,
Yes,
of course.
It does.
And the gene pool, family history.
Of course. But let's talk about diet very quickly. What are some quick changes we can do?
Well, we can start eating things in moderation instead of overdoing it. They say don't eat anything white, don't eat sweets. No, we can do that. We have to do it in moderation. Whole grains, fruits, vegetables are really good things to be eating that are going to help with diabetes.
These are all very important things. Ann Krudimski, thank you so much. We appreciate your time.
Yeah, thank you.
Coming